Hi, I'm Meshal Malik, and you're watching Indus Special. Gilead Sciences, the pharmaceutical company producing remdesivir, has signed a non-exclusive licensing agreement with 5 generic manufacturers in India and Pakistan. The aim is to expand access to this drug, which is being seen as a major breakthrough in the treatment of COVID-19. Today, we have with us the Chief Executive of Ferozsons Laboratories Limited, the only company in Pakistan that has signed the non-exclusive licensing agreement, Mr. Osman Khalid Waheed. He joins us from Lahore. Also joining us today is Ms. Victoria Yan, who is a phosphate chemist at the University of Texas. She joins us from Texas. Thank you both for joining us and welcome to the show. Mr. Osman Khalid Waheed, I'd like to begin with you. Now, this is big news for Pakistan's pharmaceutical company. What are the measures going to be taken from now on? What is the timeline that we're looking at in terms of producing the drug?
The timeline with the drug has been, I think, radically compressed as we try and deal with regulatory approvals, clinical studies, all of this in the middle of a pandemic. So our aim, now that we've signed the licensing agreement with Gilead, is to bring it to tertiary care hospitals in Pakistan as quickly as possible. Now, there are a couple of steps that we have to go through before we get there. The first, which was completed on May 12th, was the agreement itself. We'll be soon filing in with the Drug Regulatory Authority of Pakistan an urgent application for emergency authorization of this drug. What I wanted to point out at the outset is that remdesivir globally, the FDA has not granted a full-fledged commercial approval for this drug. It's been granted an emergency use authorization because, again, of the urgency of the pandemic. So in the case of Pakistan as well, this will need to be a very controlled, targeted availability. And we have to ensure that the drug, when it comes into the market, it's not misused in any way, and it's used only in appropriate setting with the appropriate number of patients. So we're hoping that over the next few weeks, this will become a little bit clearer. Once we have the regulatory approvals, we'll begin to import the raw materials and start our development batches. And then right after that, we should be able to have some drug available in the country soon.
Right. Mr. Osman Khalid Waheed, you take us through it very comprehensively, the outline of what is to follow right now. But just going back and talking about the agreement itself, what does it entail? What is the criteria, and what are the specific agreements to which your company has signed off with Gilead?
So, Gilead is a very unique company in the sense that the way it operates is different from what traditionally you would imagine big pharma operating in. It has a very unique model. And that model is driven, of course, by revenue growth, et cetera, your traditional kind of financial parameters, but also access. So Gilead was one of the companies that created these antivirals for the HIV pandemic when that broke out in most of Africa and other parts of the world as well. And what Gilead has been able to do through this licensing agreement is to ensure that even patients all over the world, regardless of where they live or their ability to pay, have some form of access to their treatments. They did that with HIV first, and then when we partnered with them in 2014, we worked together in hepatitis C and hepatitis B. And in our first year working together in Pakistan, we were able to treat over 70,000 patients with really excellent cure rates. With this agreement now, Gilead has a list of 127 low and middle income countries. So while the company itself works on making sure that the drug becomes available in its immediate surroundings in the US, in Europe, et cetera, they don't want to delay the availability of this treatment in parts of the developing world. And that's why they've signed agreements with 5 generic manufacturers, of which we are one.
Right. Mr. Waheed, could you take us through the non-exclusive part of this agreement? What exactly does that mean, especially for manufacturing drugs and making it more accessible for the masses?
So essentially, as I said, for the 127 low and middle income countries, it's not one manufacturer that's been given exclusive rights under this agreement. All 5 have been given non-exclusive mandates to supply to the developing world. And I suppose as the pandemic progresses, as the need becomes clearer, whether it's sufficient or not, then Gilead will proceed accordingly. But as it stands today, there are 5 companies that have the mandate to supply not just domestically within the subcontinent, but also to 125 countries outside these 2.
Right. Stay with me, Ms. Waheed. I want to jump to Ms. Victoria again and talk to her a little about what this drug means. It's being hailed and lauded as a breakthrough in terms of COVID-19 treatment. Is it exactly that, or is the success of it being overstated at this point in time?
So I think remdesivir definitely is a big step forward in terms of COVID-19 treatment, but there definitely is improvement that can still be made with regards to treatment. I believe many of you have already heard about the mixed results that have emerged in remdesivir clinical trials, specifically the Chinese controlled clinical trial that was recently published in late April, which was also accompanied then by the FDA's recent decision to grant remdesivir emergency use authorization in the US. So in the Chinese clinical trial, they did find that there was a numerically shorter time for patients who were treated with severe COVID-19 to leave and accelerate their improvement from the hospital. However, this difference was ultimately not statistically significant. In the NIH conducted clinical trial, however, they did find that treatment with remdesivir in patients with advanced COVID-19 was capable of eliciting a statistically significant improvement and acceleration from COVID-19 symptoms from the hospital. Compared to some of the preclinical data that has been examined in primate models of COVID-19, of SARS-CoV-2, which is the virus that causes COVID-19, these clinical trial results are not nearly as impressive as some people would have expected. But I think one of the main reasons why this discrepancy exists is because in a lot of the preclinical models and based on prior knowledge and experience with antivirals in general, antivirals tend to work best when administered early. And in both the Chinese clinical trial and in the NIH-sponsored clinical trial, patients who were treated with COVID-19 were often in very advanced or late stages. So I think that could have hampered remdesivir's efficacy.
Right. Nasyan, what more do we know about the efficacy, as you're saying, and the safety of this drug? What more needs to be done? Because we know that the research process has been accelerated given the situation we're dealing with, given this pandemic and the havoc it's wreaked across the world. But what are some of the steps that still need to be concluded in order for there to be a definite conclusion?
So remdesivir is a pretty complex drug. So there are many different steps that it requires before it can become fully activated in the body once it's taken. I think something that should definitely be explored is whether one of its metabolites is capable of eliciting the same kind of antiviral activity as remdesivir does. And the advantage of looking at this would ultimately be that these metabolites that are produced by remdesivir are a lot easier to make. So they would be a lot easier to manufacture and scale up and distribute at a broader level. Another advantage of the metabolites, of looking at one of the specific metabolites, specifically the nucleoside of remdesivir, GS441524, is that because it's a lot easier to make and it has a lot of favorable chemical properties, it would be able to possibly be formulated as a prophylactic, which would further enhance the antiviral capabilities that remdesivir and the nucleoside would hold.
Right. Mr. Waheed, on that similar point there, you talking to us as a representative of one of the largest pharmaceutical companies in Pakistan that is going to be taking on this challenge. What are some of the things that concern you in terms of how research is being accelerated at this point in time? Or do you feel like it is the need of the hour and there's no other way around it?
So I think it's very clear to understand what remdesivir is and what it isn't. So far, what the data shows, it's not a cure. But it's the one drug that has been showed in a placebo-controlled randomized trial, the NIH trial that Victoria was referring to. So that was the first kind of randomized placebo-controlled trial in over 1,000 patients, where it did show a statistically significant improvement in the patients. And the improvement was essentially that it reduced hospital stay from 15 days to 11 days, which does suggest that it is active against the virus and it plays a role in stopping the virus from replicating. As Victoria also pointed out, these trials have been done in the most advanced stages of COVID-19 patients.
Right.
So the assumption would be that if they were to be used earlier, perhaps they would be more efficacious. But I think what you're going to see is probably a cocktail of treatments emerging that together can hamper or inhibit the virus from different perspectives. There's always the risk when you are accelerating development like this that you don't simply have the time to do proper, thorough, randomized trials to the scale that you would normally do. Normally, drugs take a couple of years to come to market, specifically because of the trial requirements. All of that is being compressed. It's being compressed for a very genuine reason. Right. But at the same time, it also means that there's going to be a lot of trial and error on the way.
Right. The trial and error, how do we have this conversation right now? Because as you're saying that it's being compressed for very genuine reasons, we all are aware of that. But the trial and error and the risks that come with it, how do we have this conversation without hampering and undermining the efforts that are ongoing?
So the good thing about remdesivir, and I'm glad you pointed that out, that's a very good question. The good thing is that it's not a brand new molecule. It's been tried and tested before in patients also. It was initially being developed for Ebola, and then the different SARS and MERS variants that came over the years. So there's been enough data on its, safety in human use to be able to reach this point where the FDA granted emergency approval. But more needs to be done in terms of studying its efficacy within COVID-19 and what the ultimate benefit of this drug will be.
Right. And Mr. Waheed, as you're saying, approval for it is pending right now for the Pakistani drug authorities. Once that happens, what is the capacity we're looking at in terms of production, and how quickly will it be accessible to people?
We're in the process of developing our application to draft, so it's not pending at draft yet. Once we file, then draft's part of the responsibility comes in, and we're trying to do our part as quickly as possible. Just to give you an idea again of the speed at which things are happening, that it was only 1st of May that the FDA gave the EUA for this drug. 8th of May is when the Japanese authorities granted approval, and on the 12th of May we signed our agreements. It's really happening in hyperspeed.
Right.
And for that reason, a lot of things in terms of developing the drug are happening in parallel. We're very hopeful that once we have the draft approvals in place, then over the next, I can't give an exact number of weeks, but we are trying again to compress as much as possible. The drug should as shortly as possible be available to patients within Pakistan and also in the 126 countries outside that these 5 companies have a mandate for.
Right, Mr. Waheed, and you're taking out time from your schedule to talk to us, so I'm just going to press you for 2 last questions here. One of them being the cost point of this drug. You yourself mentioned that Gilead doesn't operate like a normal pharma company. Its main aim is to make the drug accessible for all. What type of price points are we to expect, and how do we make sure that they're regulated?
Again, largely because of the speed at which this is happening and the fact that the production of the bulk remdesivir is still being scaled up as we speak. We still don't know the end costs that the materials will be available for. But the very clear commitment that Gilead and its partners have is that we're all going to work together to make sure that these costs are lowered to as much extent as possible while being sustainable for us as manufacturers. So I can't give you, I'm sorry, an exact number right now. But the only reason why we're waiting is because we're looking at ways to bring this number down as much as possible.
Right. On another last point, talking about how you mentioned that we need to make sure that it's regulated and there's no misuse, something that we saw earlier with hydrochloroquine and other drugs. How do we make sure, especially in markets like Pakistan, that a drug like this isn't misused and it doesn't turn into self-medication?
In our initial discussions with the government, we've expressed our commitment, and I think we've developed a common understanding that when this drug does become available, it will not be sold through pharmacies. It will only be made available through government channels or to private tertiary care centers, but exactly at the centers where there's a capacity to identify and treat the patients well and really for those advanced patients that need the drug. So the supply chain is going to be a very carefully monitored, regulated process that both us, the government and the manufacturer are going to work on together.
Right. On that point, thank you, Mr. Osman, Khalid, Waheed, for taking out the time and talking to us. We're going to, of course, keep a close eye on the developments as they happen, especially related to this drug and the production of it in Pakistan. Ms. Yan, thank you so much patiently for waiting for your turn there. But talking about you as a chemist and the fact that drugs like these will now be mass-produced, what are some of the concerns that raises for the community that is involved in the production of these?
With regards to the actual synthesis of remdesivir, it is a complex synthesis because it is a complex molecule. So remdesivir in itself takes 7 steps according to the most recently published synthesis of remdesivir. Within those 7 steps, something that challenges the synthesis of the molecule is the fact that it has so many what are called chiral centers, or basically points in the molecule that have to be very specifically oriented in order for the molecule in itself to have biological activity. One of the things that I was mentioning briefly earlier is that some of its metabolites should definitely be examined for their possible antiviral activity, mainly because, for instance, one of the metabolites is the nucleoside GS441524, and this nucleoside in itself only takes 3 steps to make. And it has already shown to have antiviral properties in feline forms of coronavirus. So definitely looking at other avenues and ways to simplify the structure of remdesivir is something that should be further investigated.
Right. On that point, I'd like to introduce Dr. Patrick Tang, who is Division Chief of Pathology Sciences at Sidra Medicine. He joins us from Doha. Thank you so much, Dr. Tang, for joining us, and welcome to the show. Now, we've been talking about this new drug, which is being seen as one of the only drugs that we, for somehow, are placing our bets on for helping in the treatment of COVID-19, remdesivir. Now, you as a doctor who has been observing the outcomes of this, are you hopeful?
I think this is going to be one of the drugs that can be used against COVID-19. It's the one that's shown the most promise so far, but definitely it's not a game changer. And I think you've probably heard that a lot, that this won't be the drug that ends the outbreak.
Right, this won't be the drug that ends the outbreak. How close are we to trying to come up with a combination of other drugs that will help? How far along do you think we are in that process?
Well, there's still a lot of work that has to be done. A lot of clinical trials are still ongoing to try to combine the drugs that we have. But none of these are going to be as effective as some specific drug that gets developed that's going to work very well against COVID-19, or a vaccine that's going to be effective against the virus. So even by combining all of these drugs, we will have some benefit, but it won't be enough to get rid of this virus and the pandemic.
Right. Now, Dr. Patrick Tang, I'm curious to know, you as a doctor who is seeing everything unfold, as you're saying, there's going to take a lot of work before we get to the point where we can say that this is a combination of drugs that can just help in the treatment. We're not talking about cure yet, just help in the treatment. Now, when you see countries all over the world easing their lockdowns, does that concern you?
Well, every country has a different situation. Some countries have had the outbreak for a longer time than others, and the epidemiology of the outbreak is different in every country. So I think every country has to look at what's happening within their borders to decide whether it's time to ease their restrictions or not, and what restrictions to ease based on the behaviors of their people within their country. So, I mean, that's one part of it, but definitely drugs will help for those that are severely ill. So there are many different therapies that have been proposed, and all of them will have some degree of benefit, but maybe not enough that it could be a cure for people that have severe disease.
Right. Ms. Yan, now when we're talking about drugs like these being manufactured across the world, there being an accelerated process of research and development, are you also seeing unprecedented changes and exchanges of technology?
The biggest change in terms of accessibility and transferability of technology, and more broadly data in general, has just been the speed and availability of data that's been published on preprint servers. So the transfer of data and the, free-flowing nature of the information that scientists have been gathering around on various aspects of the disease, such as new chemical inhibitors that could possibly work in the situation, or various aspects of the biochemistry, genetics, etc., have been greatly facilitated, or at least the information has been greatly facilitated through the use of preprint servers.
Right, Dr. Patrick Kang, we've had this conversation earlier in the show, as in previous shows as well, which talks about the medical community being on the same page across the world, so there aren't mixed messages coming out to the public, especially to governments who are creating the policies. Do you think that we are moving to that point where there is a common understanding amongst medical professionals across the world?
I think the data is still coming out very fast, and how different countries and different jurisdictions are interpreting that data and using it is slightly different. But as there's more information and more experience, and some of that experience is common amongst different countries, then we'll come to some consensus on how things are done. But definitely there is some general consensus, but if you compare one country to another, there are certainly differences in how they interpret the data that's out there.
Do you see dangers with that interpretation?
Well, I think none of us know what the perfect way it is to deal with this outbreak, or to deal with people of different stages of infection yet. So I think it's important that different methods are tried, and people do clinical trials within properly to really assess which things are going to work, and when they're going to work, and on which people they're going to work on.
Right. On that point, thank you so much, Dr. Patrick Tang, for joining us from Dallas, Victoria Yan for joining us from Texas. We're going to go for a short break, but when we come back, we discuss World AIDS Vaccine Day. Stay with us. Welcome back. The world observes AIDS Vaccine Day today. The aim of this day is to raise awareness of the need for AIDS vaccines, but also to appreciate the tireless efforts of all those in the medical community to produce a vaccine. On this day, it's also important to spread awareness on how HIV can be prevented. Let's discuss this further. Joining us for this conversation is Ms. Alanna Shaikh, Global Health Consultant who focuses on health systems and the response shock. She joins us from Colombo. Also joining us today is Dr. Sokomba Aliyu, who is the President of Nigerian Association of Resident Doctors. He joins us from Lagos. Thank you both for joining us, and welcome to the show. Ms. Alanna Shaikh, I'd like to begin with you. Now, as I talked about, there have been tireless efforts by the medical community to create more awareness about the need for a vaccine, but also bring and highlight how we can prevent this disease to begin with. How do you see the efforts so far, especially when we take a look of how they have been and evolved in the past couple of years?
So I think we've seen that conversations around HIV and how to prevent HIV have really become normalized, and that we've seen access to that can prevent HIV and the other supplies that you need to prevent HIV has become much more normal and much more accessible.
Dr. Aliyu, now talking about Nigeria, and you're talking to us from Lagos, how has the experience been in trying to create more awareness for diseases like AIDS and HIV?
Some time now, the awareness of HIV/AIDS in Nigeria has evolved, and I must say to a very commendable level. At this point, we do no longer have significant stigma attached to people purchasing HIV, as well as people receiving treatment for HIV/AIDS. So people with HIV/AIDS in Nigeria can walk into any hospital of their choice and get tested and be commenced on antiretroviral therapy. So I will say that we have a very considerable level of acceptance of the disease in Nigeria. So far, it's so good.
Right. There's an acceptance of it. Is also enough support of those who have contracted the disease and how they move forward with their lives, how they can make their lives more normal?
The acceptance of the disease and the reduced stigma, people living with HIV/AIDS have become integrated into the society, and the society gives them the support they need. And I will also want to commend the effort of the support that we have received from international donors and agencies towards ensuring that these drugs are readily available for people to use. So I would say that the HIV/AIDS situation in the country has almost normalized, and people are able to access care, access this needed treatment they need, and get the support they need from their families and friends around them.
Right. Ms. Alanna, Shaikh agree with that as well, that there is greater ways for individuals to cope and gain support once after they've been diagnosed.
I think that stigma is decreasing all over the world, but I think it does remain a real challenge for people living with HIV. I think that stigma has not been completely erased in many different cultures and communities, and it's still very challenging for people. It's something they face as they try to live a normal life. That with the antiretroviral therapy drugs, people can live physically, healthily a normal life, but the challenge of stigma and of people being aware of their seropositive status continues to be an obstacle for them.
Right. How do you think we should move forward in trying to create awareness, not just for the disease, but also in terms of accepting something and accepting it as a disease that needs treatment?
I think talking about it is the first step, being open and talking about the disease and how you get the disease and the many different ways that you can get the disease. And if people are willing to talk about it once they've diagnosed, so that others can see that they're living a normal, healthy life, that the drugs help, and that it's worth getting diagnosed, it's worth getting treated.
Right. Dr. Aliyu, on that, talking about how many different ways there are to actually get the disease, it's important to have that conversation. Could you take us through it?
So basically, the disease is a disease that survives in the body fluids of human being, the blood, the semen, the saliva. To some extent, what happens is when there is an exchange, there's a contact of one person's body fluids with another person who is infected, that there's a chance of this disease being contracted. And these are the ways that it's possible the disease is contracted through one, blood transfusion. In situations in poor resource countries, there is a chance that blood transfusions are done without them undergoing the requisite screening. And so this is a very significant and important way this disease is transmitted. Secondly, the disease is transmitted when people have unprotected sexual intercourse with infected people. People having this disease, because the disease survives in the body fluids, talking about the semen and the vaginal secretions of people who may have the disease is spread also in that way.
Right. Ms. Shaikh, now when we talk about the global conversation about health at this point in time, and many doctors across the world are voicing their concerns that as we try to deal with this ongoing pandemic, many other diseases will go unnoticed, and their risk of them spreading or the risk of them becoming worse will continue. We're also seeing many people across the world miss out on vaccines. Is that also a concern that you share?
Healthcare systems and the funding that goes into healthcare is of a limited supply, and as it gets pushed into responding to COVID-19, that can mean there's less attention and less funding remaining for other issues. Around HIV, the big concern is about getting patients their medications. Is that like, how will they continue to access their medications under circumstances where they may not be able to easily access healthcare facilities or travel freely out of their homes?
Right. With all those problems, what do you think we do now to move forward? Because we know that this pandemic is not going to go away anytime soon. We don't know, we don't have any date on a cure, a vaccine, and we need to learn how to move forward with keeping it in mind. What policies do you think need to now be implemented?
So I think you're absolutely right that we need to think about this as a long-haul event that we're facing, that this isn't something temporary. This is going to be something that's going to take months or years before we see real change around COVID-19. So once you've accepted that situation, how do you respond to it? So you have to start thinking, how can we make sure that people can still get their health care even when there's this risk of this transmissible disease? And that might mean changing the way, waiting rooms are, so that patients aren't mixed together when they're waiting for health care, changing the way healthcare providers protect themselves, And it means about thinking hard about the financing and the money that we put into our healthcare systems and making sure that we compensate for the impact of COVID-19 by adding additional budgets for healthcare, because you can't stretch the budget that you already have to cover this whole new crisis without something else getting lost.
Right. And that's a very important point you mentioned there, that we need to have a more holistic view of this, and especially when we talk about healthcare budgets. Now, as we move forward and we talk about the future of creating greater awareness, what do you think are some of the gaps that need to be filled?
I think people still don't realize how very effective the antiretroviral treatments are. That if you're diagnosed with HIV, if you're HIV positive, you can live a completely normal life if you get on your medications quickly and you stay on them and take them correctly. And I think there's still a big sense that HIV is a death sentence. It's going to ruin your life. And it's very hard to be diagnosed with HIV. It's very upsetting. But the fact is, when you get on the correct medications, you can really minimize its impact on your life. So that's one thing that people don't realize. And I think another thing that people don't realize is that you really do need to use every time, unless you and your partner have been tested and you know that you're HIV negative. And that it's incredibly important to do that consistently, not just most times, but every time.
Right. On that point, thank you so much, Alanna, Shaikh, for joining us from Colombo, for talking to us. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.